A senior house officer is a non-consultant hospital doctor in the Republic of Ireland. SHOs are supervised in their work by consultants and registrars. In training posts, these registrars and consultants oversee training and are usually their designated clinical supervisors. The same structure to junior doctor grades also applied previously in the National Health Service in the UK, and informal use of the term persists there. Irish usage: NCHD grades in order, from most junior to most senior: intern a Euro, senior house officer a Euro, registrar a Euro, specialist registrar a Euro, fellow. More specifically, an SHO has worked for at least 1 year as an intern. Becoming a registrar is dependent on experience within a speciality, with or without the relevant exams, and so a doctor having changed speciality usually needs to work as an SHO for a period of time, even if he or she has previously worked as a registrar. Former UK usage: since the introduction of modernising medical careers, grades in the UK differ from those in the Republic of Ireland. British postgraduate training before MMC, doctors applied for SHO posts after completing their mandatory pre-registration house officer year after qualifying from medical school. They would typically work as an SHO for 2 or 3 years, or occasionally longer, before going on to a certain subspeciality where they would take up a specialist registrar post to train as a specialist in that particular field. To qualify for these, SHOs had to be in posts approved by a regional postgraduate dean, as well as passing postgraduate exams. SHO jobs typically lasted 4 or 6 months in various departments and were often provided in 1 or 2 year rotations. Posts not recognized by the deanery were typically referred to as Trust SHO, Junior Clinical Fellow, or other such terms. Modernizing medical careers. In 2002, the Department of Health announced reforms in the training of newly qualified doctors under the banner of Modernizing Medical Careers, merging the PRHO year and the first year of SHO training into a foundation program. This program was formally introduced in August 2005. In August 2002, Professor Sir Liam Donaldson, the then Chief Medical Officer, published a report titled Unfinished Business, which focused on reforming SHO training. The SHO grade was abolished and renamed Specialty Registrar. This change took place in 2007. Amongst the many changes, many doctors who had completed their foundation training were now appointed into a run-through training program that incorporated the previous SHO and Specialist Registrar grades. The job title changed from SHO to ST1 per Stone 2. Part of this decision was subsequently reversed in a number of specialities, with competitive entry into the registrar grade, and in these specialities the SHO level posts are referred to as CT1 per 2, and in some CT3. Current status in the UK. Doctors not on a formal training program may still be appointed in what is referred to as fixed-term specialty training appointment. Many of these positions are advertised by employing hospitals under different names, similar to the pre-MMC situation. Some hospitals use the term senior house officer in an unofficial capacity for doctors in FY2 and CT1/2 year, who often have similar working patterns in duty shift rotas. United States. In the United States, physicians in training are also sometimes referred to as senior house officers in their later years of residency, but the term is more variable in its American than its European usage. See also, junior doctor, non-consultant hospital doctor, internship, consultant. References. External links: UK Medical Training, MMC homepage.